I'm going to talk about Alzheimer's prevention and programs. Everybody knows what's Alzheimer's disease. So I don't think I have to give introduction of Alzheimer's disease. But I feel like it's always good to talk about history because when we forget history, we tend to keep repeating it. And we have done that a lot in Alzheimer's trials. It's been more than 100 years that we have described Alzheimer's disease, and description hasn't changed a whole lot. So Dr. Lois, back in 1906, described this first patient for memory loss. She was admitted to this Ehrenskolos. My German is terrible. Can anybody pronounce this word who can speak German? Okay, that you know what that means? The house of palace of insane. But she described a very classical symptom that unfortunately our patients still describe, and that was Dr. Alzheimer's. And they were able to track these people. So once you get hospitalized, I follow you in the hospital. I actually know what your pathology looked like. So he described this pathology for this patient, and that pathology is still exactly what we see, and not a whole lot of change with neurofibrillary tangles and stuff like that. We care about patients, but society many times cares just about the cost. So Alzheimer's disease is not only devastating to the person, it's very devastating financially as well. But I didn't want to blabber too much about the cost of Alzheimer's disease because this audience already knows that it's an expensive disease. Most common question I get asked is dementia and Alzheimer's disease the same thing? They're very similar, but the word Alzheimer's is actually indicative of the pathology of dementia rather than the dementia itself. But for most of the patients, when I say that you have Alzheimer's disease, they assume that I have really bad dementia or later stages of dementia. So Alzheimer's is not indicative of stage of dementia. It's actually indicative of pathology of dementia. And this is the definition, unfortunately, even Alzheimer's Association has, that decline in mental ability severe enough that person is not able to do all their activities of daily living. And I think that's a horrible definition. Imagine if we defined a breast cancer when we will only call something a breast cancer if you are stage 4. Like if anything about, we won't even call that that's a breast cancer. Our outcomes gonna be terrible. Like our dementia outcomes are terrible right now because we are defining a disease when person is already in the end stage. There is a huge problem. So what I see the future as, if we can bring down the top bar all the way bottom, let's see, can I do that? Because I think the top slides, you just have to believe what I say. I'm known to make things up. So, so what future I see? What should be the care for Alzheimer's disease? So I believe that 30 years before you're going to develop the Alzheimer's disease, we start screening. Like we do mammography, right? Why can't we screening for Alzheimer's disease? And we should have great biomarkers that tells you that, okay, this person is at a risk of developing Alzheimer's disease. You are asymptomatic right now, but you have the right gene, you have the right biochemical profile. So we can tell that, okay, in 30 years, you will have the disease or statistically. But then we individualize it or personalize it. So the screening starts and the person sees the doctor and say, oh, based on all the risk factors, you are going to develop Alzheimer's disease in the next 15 years. Because the initial screening was based on just a statistical general population data. And now we are telling you precision guideline that in next 15 years, you're going to develop Alzheimer's disease. But guess what? If you do these 7 things, you will develop it in 30 years. So if I see a 50-year-old person and I tell them that, hey, buddy, you're going to have Alzheimer's disease at the age of 65, but if you do these 7 things, you will develop it at the age of 80. I think that is a good enough motivator for some people to change their behavior. So I believe that we need precision prevention. Are we there yet? No, we are nowhere close. But we are getting closer. Surprisingly, we are getting closer. And a pill is not going to fix it. Now you're thinking, why the heck I brought out this lady here? Because I realize when I give a mastectomy example, as a breast cancer example, you can do mastectomy, right? I'm not sure any one of us is going to be ready for brain transplant, except I'm going to spill beans, Chester. Okay, so just bear with me. Except you go to Dr. Yarborough. So he does actually brain transplant. He doesn't tell anybody. In the back room, he has two closets. One time I went to see his office, and he has these two closets full of brain. One side was all male brains, and the other side were all female brains. I went to his office and I asked him, "Hey Chester, how much do you charge for this thing?" So he said, "For these male brains are $100,000, and these female brains are $10,000." I was really shocked. Chester, you come across as a like very sexist person. What happened? I said, "I'm not sexist at all. These are all unused brains. These are all used ones." So, so we talked about the word Alzheimer's, but is it prevention possible? How many people think that we can prevent Alzheimer's disease? Well, this is an Alzheimer's prevention talk, right? So, so my kids tell me, "Dad, don't ask obvious questions." So I'm talking to them about something, and then all of a sudden I come up with a question, and they look at me and say, "Dad, for last 30 minutes, you are boring us with this topic." You can't ask that. So obviously, Alzheimer's is preventable, we think. The question is, what percentage? So the Lancet Commission, which is an European commission that published a really good article in Lancet, and they said up to 40% of dementia can be preventable if you do the right things from the get-go. And all the things that I'm talking about, some of it is made up, the jokes, but everything else, everything else, I have some data. So I thought if I go through every single data, we'll be here till tomorrow. So I will do this as an audience participation. You tell me which topic you want to see data about. We'll click on that topic and I'll briefly show you the data on that topic. If you really want to take a picture of a slide, this is the slide you want to take a picture of, because other slides are mostly just different articles. So who wants to hear about which risk factor? Yeah. Which risk factor would you like to hear about? Family history or genetic? That's right. So there are tons of genes that increases your risk of Alzheimer's disease. But there is a very good saying: genes load the gun, lifestyle pulls the trigger. Genes load the gun, lifestyle pulls the trigger. So genes are not our destiny. Maybe in less than 1% of the people, it may be that these people who has this APP gene, presenilin 1 and presenilin 2 genes, there are less than 1% of population. They have early onset Alzheimer's disease, and that's strongly associated with development of Alzheimer's disease. But most commonly, I order people this ApoE gene, ApoE3 and ApoE4. They are not 100% genes. So like if you have the gene, it does not mean that you will have the disease. And if you don't have genes, does not mean you don't have disease. So these are polygenic diseases, right? These are not monogenic or single cause diseases. I think our healthcare system is still stuck in 1800 and 1900 mindset. Like we think of one infection, one antibiotic cure the disease, but it's all these chronic diseases that we all deal with, they are not one intervention disease. It has to be a multimodal intervention. So as everybody knows that you get one allele from your mother, one allele from your father. So if you have 3 genes, ApoE2, 3, and 4, total 6 combinations you can get it. If you're 3 and 3, typically I tell in the clinic that if you're 3 and 3, you're similar to general population. But if you're 3 and 4, that you're slightly higher. And if you're 4 and 4 allele, means if you're homozygous for this APOE gene, then you have a higher risk of development of Alzheimer's disease. Um, I committed myself that I'm going to only talk about 1 to 2 minutes on any question I get asked, so I can go back to this slide and then answer the next question. Very good question. I knew that I'm going to get this because this is a very commonly misunderstood topic. That's very good. That's going to be the next thing. So what are the current guidelines? So females, there should be a one more slide. Oh, that's down there. Okay. So for female that is less than 65 years of age, one single drink per day. So no more than 7 drinks per day. And for a male, no more than 14 drinks per day. I mean, per week, I don't know. You know, I just think about alcohol and I'm done. just a little. I can disclose. You know, the Super Bowl effect is still there. But this is the guidelines. Everybody knows it, so I don't want to blabber on that. But knowing what's the one standard drink is, it's very important because in everybody's glass size can be different. So learning to know what is a standard drink is. This is a French study where they tracked tons of people, like 31 million people. The whole French society, they tracked it for 5 years. They looked at hospitalization, and they looked at people who are younger than 65 years of age. Half of them, half of their dementia was from alcohol. So let me repeat this. If you have dementia at the age younger than 65 years of age, half of those people's dementia was from alcohol. But these are the people who are drinking a lot more. Now, how about the people who don't drink that much or binge drink? So this is an adolescent study. This is not quite older people study. In an adolescent study, even for adolescents, which they do binge drinking, their hippocampus volume goes down. Hippocampus is a part of the brain that is responsible for short-term memory formation. So doing binge drinking in your adolescence years is not like completely harmless. Now, what about moderate amount of alcohol consumption? So even for, so this is already, we know about what is the effect of severe amount of or significant amount of alcohol. So there is no debate about it, that there is a Wernicke's encephalopathy and Korsakoff syndrome and stuff like that. But when you look at compared to people who are abstinent, people who drink even on a mild amount has increased risk of hippocampal atrophy, and there is a slight increased risk of dementia. Now, everybody's gonna say that isn't there is a J curve, like if you don't drink at all, compared to you drink a little bit, your cardiovascular risk is lower. So when that data was collected, people who are abstainers, are they recent abstaining from alcohol, or they are long-term teetotaler? I think that makes a difference, because in the same data set, if you look at it, people who don't drink at all, they had a slight increased risk of liver cirrhosis. They say, how is that possible? Because who stops drinking, right? I smoked for 50 years. I come to get my knee replaced, and Dr. Hooton tells me that don't smoke. I stop smoking, and if in the study, if I goes as if I was a non-smoker, then it will look like non-smoking is probably better than if I'm drinking 2 cigarettes a week. So I don't want to speak about cardiovascular effect, but at least for the brain effect, the data is very clear that even a small amount of regular alcohol use can have some effect. Now, the effect is very, very mild because if you look at the mind diet, it actually does have some alcohol in it. But Mediterranean diet, mind diet is a combination of Mediterranean diet and a low salt diet. I know there is the alcohol glass at in front of most of the people, so it's very hard thing to talk about. And we also have to be clear about our own biases. Uh, I do not drink alcohol. So my inherent bias that I'm going to look at more studies which says that even little amount of alcohol is bad for you. But I've looked at a lot of meta-analysis and I've followed a lot of good Alzheimer's specialists, and almost all of them say the same thing. Same way, you most likely you're not gonna believe me if you already have made up your mind. So data is for fun most of the time. We usually look at the data to confirm all our preconceived notions. So let's see. I'll go back and see if any other question I can answer. Yes. Oh, very good. You guys are hitting all the right points. I knew that. Okay, can somebody give me some examples of ultra-processed food? Cheese that comes in a can. Anything else? No fat yogurt. That's right. We will not. Cheetos. That's right. Yeah. So my grandmother's my grandmother used to say this. This is probably way before that she saw ultra-processed food, but she used to say, if you put a food up on the shelf, and if it doesn't go bad for more than 2 to 3 days, you shouldn't be eating it. If bugs are not willing to eat it, why would you eat it, right? So, most of the things comes in its own packaging. Like if you look at apple or banana, it comes in its own packaging. If you have to put really plastic packaging around any food, not that great. But this is not a practical answer. I can't say that to patients. So what I tell my patients to do, how to identify what is an ultra-processed food. So we are trained to look at the nutrition labels, like the macros, what's the carbohydrate, what's the protein, what's the fat. But fat you get from avocado is not the same fat you get from fries, right? So it's not a one-on-one comparison. Even if you keep those things same, like saturated fat versus unsaturated fat and blah, blah, blah. Because how it is bound to each other. Instead of just looking at the nutrition, like the macros, we need to read the ingredients. When we read the ingredients, and if you cannot pronounce something, it means it's an ultra processed. Like store-bought bread. Store-bought bread has lots of emulsifiers and stabilizers in it. And 10 companies that control 60 to 70% of our calories. Let me repeat it. Only 10 multinational companies controls 60 to 70% of the calories that we eat. Guess what? Guess what percentage of calories these international companies that makes ultra-processed food controls for our kids? 90%. 90% of our kids eating are an ultra-processed food. They are drinking this juices. They are eating cereal in the morning. Everybody's eating from the packaged plastic wrapped up protein bars. Like, we think protein bars are healthy, right? Not necessarily. So they take all the food, they take the natural food, but divide it into its own individual components, and then mix it up and get to that bliss point. You put it in your mouth, it's so good. You can't stop eating it because it's designed to be that good. There are food scientists that work on it to get the best amount of flavor and crunch. it's very hard to be addicted to broccoli or apple, right? You never feel like I have to go back and eat that broccoli again. But if you start eating chips, you take one chip, it's so hard to resist not taking the next chip. There was a lawsuit on Pringle, and trying to make sure I don't go off topic. I'm known to go off topic, but I think this is such a fascinating topic. But that's why I talked for almost hour and 15 minutes just on nutrition of what kind of things we can do as a nutrition change for prevention of Alzheimer's disease. There was a lawsuit on Pringles that you cannot call it crisp. In America, we call it chips. In Britain, they call potato chips crisp. You cannot call it potato crisp because there is not enough potato in it. This was a study where they showed that there is a consuming ultra processed food was significantly associated with the increased risk of dementia. And this is a graph of the amount of ultra processed food we are consuming in America. And I'm not gonna. This is a long presentation, so I'm not gonna go in a whole lot of details. But these are the 10 companies that are controlling a lot of different things. If you are eating food, if you ask one basic question, I think that will help quite a bit. If the food was made with the profit in mind or with the love in mind? If the food was made with the greed or profit in mind, it's going to have the worst kind of components, because you want to make the food as cheap as possible, make it as fast, make it last as long as possible, make it as calorie condensed as possible. Because guess what? If you leave more fiber in the food, if people have to chew more, if people chew more, they feel full. So they won't keep eating the same food over and over again. You want to get as much fiber from the food out as possible so people can keep eating. So most of the packaged food that we eat is very dehydrated, and a lot of fiber is taken out from it. And we are a fiber deficient society. Like we think that we are protein deficient society. We are actually a fiber deficient society. But I'll go back to something else. And Emma's going to tell me if I'm going over the time. Any other risk factor you guys would like to talk about? Yes, I don't have data to show you for that, but in your middle-age years, if you keep doing the same job over and over again, that is not cognitively stimulating. It is bad for you compared to what you do, right? Like, yes, sir. So playing a sport is not, I don't have data on sport. There is data on sport. I just haven't had a chance to collect that data and show it here. But there is a good amount of studies that playing any kind of sport, physical sport is better. Team sport is even better. Increases your risk of, like I should say, decreases your risk of development of dementia. So seniors that are involved in playing some kind of communal sport, they are much more protected. Are they? Think that, oh, this like prevented, or I got the right group of people did the right thing. They all look 10 years younger than parents, but the potential too young, and I felt the same. You know, but if you keep it old playing, so younger guys like 10 or 7 or genetically more fit, is that a cause? Yeah, so that's a very good question, and I hear that all the time. More and more clear, even low levels of trauma is terrible for you. So the relative risk of things like ALS, dementia, all kinds of high rate, So you're exactly right. When I talk about communal sport, the way we play sport is not how humans played sport all their evolution. Like our American football is horrible, or rugby is horrible for a person's brain. Like I have personally seen lots of people who played lots of football and they have early onset dementia. So, but helmet protects your skull, doesn't protect your brain. So, uh, and I know there are a lot of people in the room, they love football and it's a great game, but it is not great for the brain. You asked a question about immunization. So taking multiple vaccines for elderly is preventive of development of dementia. And you think, what the heck? How is the vaccines going to prevent dementia? But guess what? When you take all this preventive shots and you have a less amount of inflammations, like you get less number of viral infections, you are not going through that systemic inflammatory response. So you are not having transferred inflammation to your brain, and you have lower risk of development of Alzheimer's disease.
So among those years, you have all those vaccines,
But
all those years that I can have more wine.
yes, we cannot justify wine for one way or other. So yes. I'm going to take one more question, but I have data on most of these things, and I will send out an article, which was the Lancet article from 2020. So it should have lots of other information. Yes, sir. Yeah. So, so there is data. I'm not sure I have it here, but meditation or mindfulness has lots of protective effects. Aarti is probably the better person to talk about it than I do. She runs meditation. She helps organize meditation workshops and stuff like that. And actually, Jane does a lot of meditation and teaches meditation. So how does it help? I will go a little bit off track. So we have default mode network. And when we are doing meditation, that's the only time where default mode network gets activated without anything else getting activated. So that may be one of the reasons. But I'll take the liberty and I'll click on spiritual connectedness because that is very similar to meditation and mindfulness and stuff like that. This is a really old study, but this is a very inspirational study that got published in 1986 by Dr. David Snowden. He's a PhD epidemiologist. He tracked 678 Catholic nuns, Roman Catholic nuns. These women were 76 to 106 years old. He followed them for a long time. And when they died, they did the autopsy. And guess what? In autopsy, large number of these nuns had Alzheimer's pathology. They had lacunar strokes, they had a brain shrinkage. Then he went back, looked at their diaries, because nuns do a really good job writing down in their diaries. And if you look at their diaries, they were active, they were singing, they were preaching, they were teaching those young kids, they were involved in music. No sign of dementia. I was wondering, this MRI, means their autopsy, so shows the signs of Alzheimer's pathology and no clinical signs of Alzheimer's disease. And this is a lot of women. It was not like one or two cases. It actually got a lot of publicity back then, but then everything died down. Like it was an observational study, but still an amazing study. And they tried to look for the confounding factors. Is this the nature or the nurture? So they actually went back and looked at the essays these people wrote when they tried to get being a nun. So being spiritually connected may also includes being connected socially, having a lot more support network and stuff like that. So I will stop at taking questions on risk factors. But if I have to ask one question, if one risk factor, if you have to modify just one risk factor among all these things, which risk factor would you modify to reduce your risk of dementia the most? Say it again. Sedentary behavior. That's a good thought. I should say which risk factor has the most data on it too. Smoking. That's a good thought. socialization. So lack of socialization or social isolation is highly associated with dementia. Uh, they say social isolation is as bad as smoking 15 cigarettes a day. UK actually has a ministry of social isolation, but the risk factor is hypertension. Probably Harmeet has prevented more dementia than I have. Uh, Diabetes is obvious, stress is obvious. Is there anything that I did not talk about? Um,
Hey,
sleep,
Hemang, this is
sleep is
Jayashree.
very important. Lack of sleep. So in general, we are also sleep deprived society. I will not show the evidence. Just trust me what I say. Uh, when we shrink this as in general as a society, we are deprived 1 to 2 hours than what we should be sleeping on average. Some individuals are deprived a lot more than what they should be getting as a sleep. Sleep is so important, not only when you acquire the information, but how you retain the information. So as you guys know, when we go into the deep state, when we go to the sleep, we have REM sleep and we have non-REM sleep. REM sleep is a time where you do memory consolidation. So you take memory from your hippocampus, so all the circuits in the hippocampus, and you transfer it to your neocortex during your REM sleep. Guess what? When you wake up early in the morning to go for that run, what do you skip? You end up skipping your REM sleep. So exercise is good, but you wanna get your good sleep before you go out for that exercise. So now, uh, deep sleep is also very important in terms of removing Alzheimer's pathology in the brain. So when I went to med school, there was no lymphatic system. So I learned about lymphatic system in the body, but we have something called lymphatic system in our brain, which removes its beta amyloid and tau protein and stuff like that. Guess what? When you don't go into the deep stages of sleep, the lymphatic system doesn't work that well. Because when you are in the deep stages of sleep and your brain is pulsating, it's actually removing beta amyloid from your brain. So if you don't go into the deep stages of sleep, you wake up grumpy, right? Because brain did not get all the things that it needed and didn't get rid of all the toxins. So that's why sleep apnea has been associated with so many neurological things, including memory problems. So I can go on a little bit more on sleep, but go on to the next one. Not much, but something is better than nothing. So watches uses actigraphy to see what sleep stage you are in, and the movement is not a very good indicator of exactly what stage of sleep you are in, if you're sleep apnea or if you're REM disorder or something like that. But still, something is better than nothing. At least it tells you what time you want to bed and what time you woke up. I won't trust hypnograms as much. Hypnograms for everybody, as you know, it's like it tells you what stage of sleep you are in. It's not that reliable, but it's still something is better than nothing. So, one thing that nobody wants to talk about is hearing impairment. Even subclinical hearing impairment increases your risk of having dementia. So, I tell my patients to get their hearing checked on a regular basis. So the reason I put up a picture of Dr. Kivipelto, because do you mind getting to the slide? I don't know why it went to this slide, genetic slide. Let's see. So I actually have like 336 slides. So I knew I'm not gonna go through everything. That's right. So I'll go up here. So I have a lot of respect for Dr. Mia Kivipelto. The program that I come up with is based on the ideas that she has. And she came up with this trial called Finger Trial. That was the foundational trial of thinking about multimodal intervention for preventing Alzheimer's disease. These are all simple things like exercising, eating healthy, keeping your mind stimulated, being socially active, controlling your cardiovascular risk factors and stuff like that. I'll just take a minute to talk about her CV. So 1999, she becomes a doctor. 2002, she has PhD. 2006, she already is an associate professor. In 2012, she publishes this landmark trial, which shows that hypertension is really bad for Alzheimer's disease. And she gets a lot of flack about saying that you should try multimodal intervention. Many journals openly criticized her, saying that you cannot do multimodal intervention because if you do multimodal intervention, you won't be able to tell which intervention is actually causing the effect. And she says, I don't care because patients don't care. Patients don't care about what percentage of dementia was prevented by hypertension medicine or diabetes medicine or exercise or eating right. We have data on each individual things. Why not to put all those things together and see if that makes a difference? But those studies are really hard studies to do because guess what? Who signs up for all this research? Usually health nut people, like people who are really interested into looking out for their own health, signs up for this kind of intervention trial, and they know that they are signing up for a multimodal intervention trial, and every 3 months they are getting all these pamphlets on what they should do. So that's their control group. So now imagine that you already have a highly motivated person who wants to prevent dementia, signs up for a trial, is getting every 3 months advice on what they should be doing, and that is your control group. So how do you show a difference in this population? So you have to come up with an intervention group where you are not just telling people what to do, because just telling people what to do does not work. How many times we have told patients to exercise? People don't even remember that I told them to exercise. Like every single visit, I tell them to exercise and eat right, and I'll give you a recipe. By the time they come back, they don't even remember that I told them to exercise and eat right. It just doesn't sink in. But if you're a part of a program, you are much more likely to do it than be a control group. So her study was around 1,200 people in 2015. Now in 2018, she did worldwide fingers, and her participants are, the goal is 10,000 people worldwide. And I just showed some of the studies that she is managing. Can you imagine? She's probably barely 5-6 years older than me, and she's able to pull this whole thing off, going from a medical school student or MD to going to the point of running a worldwide trial with 10,000 participants. And other places have done as well. So people with interest, who knows about Alzheimer's prevention, Rush University in Chicago does a lot of work as well. I'm not going to show any of a lot of stuff, but this was a good thing. So instead of saying that what actually works or which component actually works, you can divide people by adherence. Like, how do you know that something works or not, right? Like if you're doing everything in one group, then how do you know that that thing actually works or not? So you can divide people whether how much they adhere to it. So you did on, so they give different ranks. They ask people to do 5 things to make sure that you don't smoke, you do 150 minutes of moderate to vigorous physical activity, have a light alcohol consumption, high quality mind diet, and engage in cognitive activity. So they rank people from 0 to 5. So the higher your adherence, lower the risk of development of dementia. So if you do all these interventions, you're likely to do better. So in my program, I specifically tell my participants, don't try to do everything because you're going to burn out. Because there's so many things you will have to do. So instead, just do 1 or 2 things. I want you to be a B+ student. because we are all anal. We want an A+ student, but I want you to be a B+ student, just a little bit. And that adds up eventually, rather than you try to do everything possible, like try to run marathon like Krishna, it doesn't work. Right? You have to do it slowly and gradually to get to her stage. Uh, and people may think that Alzheimer's prevention may be just one or two articles or one or two meta-analysis. Guess what? Alzheimer's prevention has a whole journal. There is a journal of Alzheimer's disease prevention, and its journal is in publication since 2014, and none of us know about it. But how many of you have heard the Biogen drug aducanumab? The Biogen came out with a new infusion drugs. Um, and what was the impact of that drug? Teeny tiny. You can barely see. Biogen actually pulled that drug out of the market. So they were going to charge $56,000 per year. 1 out of 4 person can have a brain swelling or bleeding into the brain or something like that. And everybody knew about that drug intervention, but there is a whole journal that talks about Alzheimer's prevention and nobody knows about it because these are not sexy things. I have had 1 or 2 patients who has done Leqembi or lecanemab. They did not notice any change because the goal of the IV infusion is to prevent you from having declining. So it's not, you're not getting better, you are just staying stable. So aducanumab, yeah. So Duke did started an adjuvant program, but the Biogen stopped it. So now they are doing lecanemab program. But if everybody who's eligible to get the lecanemab, if they get it, the whole Medicare budget will go just to pay for this one drug, the whole Medicare budget. So I don't think we have money to do all this expensive drugs. That's why we have to do cheap things that I'm talking about. So I have 15 minutes, and I actually want to also talk about the program. So first we talked about what is Alzheimer's disease. The next we talked about Alzheimer's is actually preventable, but you have to start early, right? As I may have mentioned, the disease starts 20 to 25 years before you have your first clinical symptom. And some people have a hard time believing that. And how is that possible? But how do we believe that the day you get dialysis is not the day you had your kidney problem? Your kidney problem started 20, 30 years before you had dialysis, or the day you had a heart attack is not the day you had a cholesterol problem, right? All these pathologies, they build up in our system. And then the day you run out of compliance that's when you have your symptom. So why is it different for Alzheimer's disease or dementia, right? So I believe that Alzheimer's disease is a disease of middle age that presents in late age. Let me repeat. I believe Alzheimer's disease is a disease of middle age that presents in later age. Now, that middle age and later age can be different for different people. For example, Dr. Kanodal, I'm going to say it out loud. His biological age or chronological age is 72. But his metabolic age was 58. I have asked his permission, by the way. So our metabolic age may not be the same as our biological or our chronological age. And I know one person whose chronological age was 33 and her metabolic age was 58. So she was only 10 years further from further from Wally. But in real life, they were 40 years apart. So middle age for one person may not be the same as middle age for other person. So that's why I'm repeating that Alzheimer's disease is a disease of middle age that presents itself in later age years. So I'm really passionate about doing this prevention kind of things, and I'm practicing for 10 years, and then I realized, oh my God, did I lose my focus? Because I'm just seeing patient after patient after patient, and nobody's changing their lifestyle. And I told myself that I don't want to keep doing this thing. I want to actually make change in people's life. So what can I do? or what I would want for myself, right? For myself, I want to do everything that I can to becoming one of the patients that I see. So these are the list of things I would want for myself. And then I will do it, start for a very small group of people. It's a very time consuming, energy intense process. But they say, what you wish for mass, you have to do it for one. Because if you can do it for one or two, then you can worry about scaling it. But if the day one I worry about scaling it, that how is this going to happen to everybody? Or is it going to be able everybody going to be able to do it? Then I won't be able to do it for one. So I'm going to start as a small project. My goal is to make it big and accessible to everybody. So what do we do as a part of the program? So as a part of the program, I meet people once every month as a group visit and talk about one thing. So the first time we met, we talked about nutrition. Uh, and the next time we're going to be meeting, I'm going to be just talking about exercise. So instead of just telling person that eat healthy, it's not enough because the definition of healthy is different for different people. When I go to grocery store and buy low-fat yogurt or buy so-called whole grain bread or buy that protein bar or buy that protein shake, I think I'm doing something good for myself, and I may not be. Like when I buy that hard, healthy cereal, I think I'm doing good. Or we tell people to eat more protein because we think that that's gonna be good for them. There is a big protein myth. We are eating a lot more protein than what we actually need. And guess what happens to extra protein that we eat? Where do we store protein in the body? All the structure that we have that we store protein in. But if we eat extra protein, there is no place for our body to store it. So guess what body does? It converts that protein into glycogen first and then fat second. So if you eat more protein than what you need, essentially eating fat. Sorry to say that when you. So if we have more fiber connected to the protein, we maybe actually utilize that protein more. But there is no time to talk about this detail in my clinic visit. We put people on freestyle libre, where where we monitor the CGM, because so far we were thinking that it's just what's your macro that counts, but maybe their insulin resistance may count more. There is a theory that Alzheimer's may be a type 3 diabetes. So the people who are participating, when they eat something, they can see the spike of their sugar, and they may be able to modify their behavior much easier. Because we all like instant feedback, right? When you do something, and if you see and response, you can modulate your behavior much better. We do this body composition scale where we not only look at your weight, which is a very poor marker of health, actually, same as BMI, because you can be very muscular and your BMI can be high, but if you're a lot of visceral fat, that can be really bad. So when we do this body composition scale, we look at what's your total fat mass, muscle mass, and stuff like that. In those people, I check their biomarkers, like if they have ATN, kind of like amyloid, tau protein, neurofilament light chain protein, and other things like the treatable causes of memory problems that everybody knows, like B12 and B1 and things like that. We also do their ApoE testing to see what gene you have. When we do the MRI, we do neuroquant MRI. As some of you know, neuroquant is a quantitative measurement of different parts of your brain. So when I look at your 71-year-old brain, I'm not guessing that is this shrunken or not. The software goes in and color codes the different parts of the brain, comes up with the volumetric data, and compares it to the people of the same age and gender and skull size. And then I can tell you, well, your hippocampus is 33 percentile, so you should be okay. rather than it's in a guess. Um, we set people up on this app called Everfit. Everfit is an app that participants download on their phone, where however number of steps they are walking or what kind of physical activity they are doing, it should sink in. It hasn't worked completely just yet. Uh, we ask people to do this brain HQ, like brain training exercises and stuff like that. And Wally was nice enough to volunteer to speak about his experience with brain HQ. This is excellent. Thank you. So it's 7:30. So that's the time that I was allowed. Okay. Don't give me too much leverage, otherwise we'll dwindle down to a few people and I'll be keep talking. So I'll just tell you one example about exercise. So in one of my talks, I tell people, don't be a sea squirt. You know what is a sea squirt? Sea squirt is a very primitive ocean animal, even if you call it an animal, like a sponge-like thing, which is a filter feeder. So it's just a tubular structure. The water goes through and it gets the nutrients out of it. When it is born, it has a brain and it has a tail. So once it's born, it goes to the floor of the ocean, finds a good place, sits down. Guess what's the first thing it does? The first thing it does, it dissolves its own brain. Can you imagine an animal, once it reaches adulthood, sits on a rock and dissolves the brain? Because it's not needed anymore. I don't need to move. I don't need to have a tail. I don't need to move. I don't need to have brain. So why would an organism do that, right? Why would it get rid of brain? Because it's highly metabolically active thing. So our brain is 1 to 2% of our body weight, eats up 25% of the energy that we eat. Can you imagine? 25% of the energy that we eat goes to feeding our brain because it's highly metabolically active organ. So if you don't have to feed something that is this metabolically active, when you have scarcity of food, like having this food all the time in front of us, it's rare evolution wise. Like no organism had this abundant access to food all the time. So we evolved in a way of scarcity. So if you don't need something, if you don't use it, you just lose it. Guess what happens? People retire, they go home, they sit on that chair, and their brain starts shrinking. So I tell people, don't be a sea squirt, because if you just sit, you're gonna dissolve your own brain. And I see that all the time. You guys may have seen it. Like you've seen people retire, their activity goes down, they start having 10 medical problems. More things we have to help us is actually makes us weaker. Like I remember when I was young, my mom remembered every single person's phone number. Like you ask her anybody's number, and she'll tell you that's their number. I can barely remember my number and my wife's number. That's all. I have to have my phone to call my parents, and that's really sad. So more crutches we use, more time. The less time our brain gets tired. What Dr. Conroy said, it's not growing. So if you're doing an activity and if you feel like this easy, means you are not challenging your brain enough. So if something comes natural to you, you're not challenging your brain enough. Same thing in exercise. Like some people do endurance training. Like say, oh, I go out for a walk 30 minutes a day, 4 to 5 days a week. Is that enough? Not enough if you don't feel tired afterwards. So you have to do strength training. So there is some data that people who do resistance training, that's better than just endurance training. So just walking is not enough. We have to do resistance training. We have to do balance training, right? What's the most common reason people end up in a nursing home? They fall, they break their hip, but they end up in a nursing home. If you have a really good balance, you may be able to prevent that. So I'm gonna stop talking about this, except I'll say one more thing about Everfit app. Because it's hard to pay attention to almost an hour, right? Like even for bright people like you, I can see there are some people losing on. So imagine a patient who may be at a risk of developing dementia. How are they going to be able to hear me for hours talk about something that they don't want to hear about, right? So my long-term goal is put up all this video on the Everfit app, and they can just watch me 5 minutes a day talk about one thing and actually think about it, and then think about putting it into a practice rather than me giving them 1 hour lecture, which they can watch on a YouTube. You know, there are not lack of lectures on YouTube. If you can look up Alzheimer's prevention on YouTube, there are tons and tons of lectures telling you what to do. Most of them are reliable. Some of them are very fishy. So I wouldn't trust everybody on internet, including myself, because I'm on internet. So um, but most of the people they give really good reliable advice, but that doesn't turn into action because we all have easy access to information, and if the easy access to information was the solution, we will all be doing the right things. So I will call it a day. If you want to read more about it, you have access to my website. It's mybraindoctor.com. But I'll be happy to answer any